Hey everyone, I'm Steven.
I'm Bastian.
Justin?
And I'm Yash. And we're a group of Hershey High School seniors. We started CARE when we realized that we could actually make an impact in our community. So what is CARE? CARE, or COVID Action and Relief Establishment, is a fund we created to help those in our community. We noticed that there were certain groups that were disproportionately affected by this pandemic, and we decided it was important to help these people. As of now, we are focusing on aiding the homeless communities in our area, and we've already donated to 4 shelters. We plan on continually donating to shelters as long as we have the funds and supplies necessary to. So far, we've managed to raise over $600 from our GoFundMe and over 200 more going from door to door. And we could not have done it without our amazing support from the community. We also noticed another problem, that people are being misinformed about the pandemic. To combat this misinformation, we've been posting safety tips that would help minimize the spread of COVID-19 on our Instagram. If you have any questions, please feel free to DM us on our Instagram page.
So how did we start? We started by first coming up with a plan on how we were going to help our community. We decided we wanted to help homeless shelters because lots of them needed supplies. We needed a way to raise money, so we got a GoFundMe and went around our neighborhood collecting money. We then went on to make a logo, a website, and an Instagram.
So why do we do this? We're doing this because we have the opportunity, since there isn't much to do during quarantine, to actually make a change. We don't want to look back on this period in our high school career as a time in which we spent countless hours binging Netflix and scrolling through Instagram. Rather, we want to remember this as a period of self-growth, a period of helping people that cannot help themselves, and a period of doing the government's job in educating and raising awareness of the gravity of our situation.
So how can the community help? Since our project is still pretty new, our existence is entirely dependent on the support of the Hershey and Harrisburg community. Because of this, we value and appreciate all contributions and aid.
So why are these communities disadvantaged in the first place? Racial inequality. Most minority groups experience homelessness at higher levels than whites, making up a disproportionate share of the homeless population. Homelessness affects one minority group in particular more than others, African Americans. African Americans have been systematically denied equal rights and opportunities during slavery and segregation, and the effects of this still live today. These effects lead to disparities in poverty, housing, criminal justice, and healthcare, which contribute to their homelessness. Now, poverty is obviously a strong predictor of homelessness. African American households are more likely to experience poverty than white families. More than 1 in 5 African Americans live in poverty. Now, about rental housing discrimination. Black families are more likely to live in areas of concentrated poverty, areas that have limited economic opportunities, fewer services, and poorer educational resources. People who become homeless are likely to have lived in these areas immediately before their situation. Third, incarceration rates for African Americans tripled between 1986 and 2016, and is 6 times the white incarceration rate. But when they finish their sentence, new obstacles are presented for them. Their prior involvement in the criminal justice system keeps them from successfully passing background checks needed to secure housing or employment. These people face problems in accessing safe and affordable housing, which can result in homelessness.
So why do these people have problems accessing safe and affordable housing in the first place? The issue is fairly complex, but a main part of the issue is redlining. What is redlining? Redlining was coined in the 1960s to describe the discriminatory practice of fencing off areas where banks would avoid investments based on community demographics. As a result of banks and other mortgage lenders commonly rejecting loans for creditworthy borrowers based strictly on where they lived, it became harder for these people, disproportionately being minorities, to gain wealth, as owning a home is one of the main ways people in the lower middle class gain equity. Even if this process was banned, in part by the Fair Housing Act, the act was barely enforced, and it remains to this day more difficult for minorities to get loans and mortgages. Also, the primary way Americans pay for public schools is through a property tax, which means people with more valuable homes have better funded schools. Since redlining was never truly resolved and the property values in minority neighborhoods are lower, it means their schools are poorly funded. If the schools in these redline communities are poorly funded, it gives minority students a lower chance at academic success. Having a high school diploma or degree significantly impacts income. On average, the higher degree a person has, the more money they make. The impacts of redlining, a major part of racial inequality, need to be resolved if we want to have anything close to true equality and a fair economic system.
In addition, issues about inequitable healthcare and food deserts have only gotten worse due to the pandemic. Let's start off with defining what a food desert is. A food desert is an area where affordable and healthy food options are limited. Food deserts are most common in urban areas, where minorities live. COVID-19 has only worsened this issue as wide-scale job loss makes healthy food even less affordable to these communities. With an increased amount of unhealthy food being eaten, there is going to be an increased amount of health issues with these communities. With healthcare in America already being extremely expensive, these communities cannot afford proper treatment for any illness that is caused by an unhealthy diet, so their illness will go untreated. On top of that, people who are on the brink of being homeless have now become homeless. Due to job loss and lack of stimulus checks by the federal government, an increased number of people are now in need of aid, and now homeless shelters need all the support they can get. Our mission is to aid these homeless shelters so that they can be better prepared to help our community in these uncertain times. We hope that through our donations, we will be able to relieve some of the financial burden that these homeless have.
We know we can't possibly change how unfair this system is. That's the job of the government. But we can alleviate at least some of the issues that people face in this pandemic. For this school year, we would like to turn our mission into a club or a group in the high school. So what safety precautions do we practice? Every time we deliver a care package, we meet to disinfect all the products we bought. This is good practice since we don't know who handled the items in stores and it lessens the risk of transmission. Of course, we did all this wearing masks and follow social distancing rules.